This is Reset. I'm Becky Vivi. Our mouths are the gateway to our overall health. And recent studies show that COVID-19 is linked to oral health. But dentist offices, which are now mostly open, are backed up for months. It might be a long time before you can get in for a visit. Joining me now to help break down the COVID oral health connection and give us tips for optimizing our overall oral health from home is a Chicago-based pediatric dentist, Dr. Mark Cannon. He's also a clinical professor of dental surgery at Northwestern University. Dr. Cannon, hi. Thanks for joining us on Reset.
Well, thank you so much for having me. I'm a big fan of your radio station and listened to it for a very, very long time.
Well, great. We love all of our longtime listeners. So I wanted to talk to you a little bit about what we know about this link to between COVID and oral health. What are we finding out?
Well, it's the same link that we have found to everything else. And you started it off beautifully when you described the oral cavity, the mouth, as being the gateway. It is the most classic gateway ever. And we'll get to COVID real quick, but it's actually a gateway microbiome. That is, a set of bacteria in the mouth are there for a specific purpose to protect and to process everything that enters into the body. We have evolved that way with a specific type of bacteria population. Now, there's other gateways like the placental gateway microbiome. Mm-hmm. But the oral one is so important because, as you know, many diseases come in through the mouth and through the nose. So having the appropriate bacteria in the oral cavity is essential. Now, a good example would be wearing a mask. You wear a mask because it not only may help you not get sick, but if you do come down with COVID-19, if you're wearing a mask, you probably will get less sick. There's a lot of research on that because a mask is forming a barrier and reduces the type of load of SARS-CoV-2 virus you get. So you get more inoculated than infected, right? That's why you can have it asymptomatically almost. Well, in the oral cavity, you have bacteria that produce the beneficial ones, hydrogen peroxide naturally, which is one of the key ways of killing many of these viruses, not just SARS-CoV-2, but H1N1 and human respiratory syncytial virus. All these viruses are very sensitive to these bacteria.
Well, right, and it's interesting because I think when as we were learning more about COVID-19, and this whole idea of do we wear a mask, do we not wear a mask? I think it's very obvious now it's good to wear a mask. And your point about it being the gateway, could you talk just a little bit about other diseases that are linked to, poor oral health, if you will?
Well, just very recently, you've seen a whole bunch of articles come out, for instance, on Alzheimer's and inflammatory Alzheimer's. And now they know that is caused by something called gingipanes, produce this effect in the brain, and we have now linked specific oral bacteria to Alzheimer's. And just very recently, in the National Health and Nutrition Examination Survey, where they followed people for 26 years, they found that, yes, gum disease precedes Alzheimer's and dementia, just like they've shown that gum disease precedes atherosclerosis and cardiovascular disease. In reality, this is shocking. Mm-hmm. There's one specific strain of one species that is responsible for much of the cardiovascular disease, much of the Alzheimer's, much of the effect you see with diabetes and obesity. So all the big comorbidities that you see that are responsible for the end bad result with COVID-19, they all have a link to specific bacteria and specifically a couple of strains that are so much so involved with all this disease process.
Right, interesting. So, because if we've established that oral health is important, as people have been quarantining, people haven't been going to the dentist necessarily, or they're trying to get an appointment. What is it like right now in speaking with dentists or in your own practice? Is there a big backlog for people to get in? Are some of your patients concerned still about the safety of coming in?
Yes, there's people who've been concerned about safety, but we were actually at the forefront in the practice at introducing all the important protective mechanisms. And before we opened the office, we had all the team members. We were tested for antibodies. We were tested for the SARS-CoV-2 virus itself with a PCR test. We changed all the upholstery. We put in the HEPA filters, and all the other dental offices are doing this. Everyone has responded. That's why when the World Health Organization came out with their guidelines, the guidelines were not actually very appropriate for the United States, because in the United States, dental offices went out, they purchased the face shields, they purchased the N95 masks, they bought the HEPA air filters, they changed all their sterilization. We do remote check-in. People check in remotely. They do remote checkout. We do everything we can to eliminate any potential of spread. And in dentistry, we're used to that. We're used to having outstanding infection control to begin with.
Right, usually because, I mean, you're face-to-face, so close to folks. You've always had the N95 masks or the shields when you're working on patients. I want to know what are some recommendations for taking care of one's oral health from home during COVID? If you can't get to the dentist, what would you say? What sort of advice would you give to folks for keeping their mouths healthy?
Well, obviously, maintaining good oral hygiene practices is essential. With making sure you have a relatively new toothbrush that's a good toothbrush and not just something that was very inexpensive and poorly made. But the other thing is, of course, diet is essential, and probiotics. And you probably know that I've been involved with probiotic research for decades, and I'm very, very big believer in it. We've done clinical trials at the, actual published clinical trials at my practice, where we showed that probiotics are one of the most effective ways of preventing disease that we have. And we're not the only ones. We have many studies that have collaborated, have actually supported our findings.
When you say probiotics, do you mean, I've heard of like gut probiotics. Is it the same thing? It's the kinds of foods you're putting in your mouth?
No, not really. You see, there are some very specific strains that have been really well studied that are special strains that live in the oral cavity that, oddly enough, guess what, produce hydrogen peroxide. And they do so, and they prevent periodontal disease, gum disease, they prevent cavities. Like I said, they could inhibit any viral load that you get because they're naturally producing what kills the bad pathogens, what kills the bad germs. Personally, in the office, we use what's called the ProBiora line. We use ProBiora Pro, which is 3 very specific bacteria that are very beneficial. Been studied since the early 1980s. But this is all stuff that has to do with the microbiome. I mean, you either feed good bacteria or you feed bad bacteria. So during times like quarantine, stay away from the sugar, because the sugar, obviously, if you've been to the UK or you've seen their ads, I should say, from the UK, they have these great ads that start off saying, cardiac, COVID, cancer, what do they all have in common? And they show a donut.
Yeah.
I don't know if you've seen those ads, but that's so true, because sugar increase your risk of cancer. Sugar increase your risk of high blood pressure. It's one of the key things for hypertension that we now know in research. And sugar feeds the bad bacteria, and these bad bacteria are the ones that make you more likely to be sick, period.
Right.
Because they knock out your innate immune system. It's amazing how they have evolved to actually shut down our defense mechanisms.
We're speaking with Dr. Mark Cannon, clinical professor of dental surgery at Northwestern University. We're talking about the importance of oral health during the COVID-19 pandemic, and always. Coming up in 10 minutes, a Southside home designed by world-renowned architect Frank Lloyd Wright is officially off the market. We'll bring you the details and speak to its new owner. So I have a question here from our host, Lisa Labus. How do you know a good quality toothbrush from a cheap one, or one that, you shouldn't use?
Well, if you get a really good major brand name one, I would see where it's made, number one. For instance, I don't want to go into brands right now,
Sure,
but we typically like to have one it's actually made out of Wisconsin, and it's very, very highly polished, good nylon. I would stay away from the imports because just the quality of the nylon, and they don't polish the edges, so you can have more abrasive effect from those type of toothbrushes. But see, that brings up mouth rinses too, because we've had kind of a over-reliance on mouth rinses, and this is going to be shocking to you, but specific mouth rinses on the market actually increase your chance of having diabetes. And that's well known, well published from the San Juan longitudinal study, that certain mouth rinses, because they kill off beneficial bacteria in your mouth, will actually make you more prone to diabetes and hence obesity down the road. Mm-hmm. And there's others on the market that actually the bad bacteria become immune to in just 9 to 10 days. And after that, you're not getting any benefit, but you are killing the good positive bacteria.
Got it. Are there any special considerations we should consider for children in their oral health?
Well, one of the most important things for children in their oral health, I again go back to probiotics on that. I tell you, we give out samples of the good probiotics, like I mentioned before, the ProBiora Pro, and you can get ProBiora Plus at any store. For the really young kids, we use one called BioGaia for the under age 3, which has had research going back to the 1980s also. And those studies back how well they are performing in reducing cavities and other issues. They're just really good, healthy bacteria that are missing. You have to remember, here's a couple of important concepts, and this goes back to evolution and Darwin and the principles. One of the most important principles is all life is connected to other life. So if you end up reducing your diversity of good bacteria in the mouth, everything goes. I mean, it's just fascinating. You are more at risk for oral cancer, for esophageal cancer, and it's for gastric cancer. And that was just published in the magazine Gut. All of last year, they followed and periodontal disease. If you have gum disease, you're more prone to have cancer.
Okay. Well, how do you see the field of dentistry changing post-pandemic? Do you see it changing in any way?
Oh, yes, I see a lot of changes. I'm part of the American Academy for Oral Systemic Health. I'm a board member of, we call it AOSH. We've been teaching that the most important thing for us to do is work together. We collaborate. Physicians worked, in fact, at our last meeting, we had many physicians who are contributing to the meeting. We work with our physician to coordinate care so we can treat hypertension by increasing the good bacteria in the mouth that drops your blood pressure and protects your heart. Even the American Heart Association just came out with that. Did you know that? They just came out with a paper on the protection of the nitrate-reducing bacteria in the oral cavity as being one of the most important things for cardiometabolic health. So as a board member of AOSH, we're out there educating everyone and inviting everyone to join us in showing that we can work together and collaborate, physician, dentist, pharmacist, nurse, everyone together for the better health of all of our patients. And we all should be talking about diet, nutrition, eating good, healthy, fresh food, and staying away from all the processed fast food, because that's what they say, half of the adult population in Chicagoland, or the older adult population, are in metabolic syndrome. Mm-hmm. That's not good. And this is where, when patients come in to see the dentist now every 6 months, we're going to be talking to you about good bacteria, about good diet, about exercise, or nitrate-reducing bacteria. That's where we're heading. That's the future.
That's great. Well, Dr. Mark Cannon, thank you so much for joining us.
Well, thank you so much for having me on. It was truly an honor. Thank you.
Yes, Dr. Mark Cannon is a Chicago-based pediatric dentist. He's also a clinical professor of dental surgery at Northwestern University.